Welcome to Dementia Friendly Prince George's County, Maryland Northern Sector webinar series for caregivers. Today's topic is Medicare Supplement versus Medicare Advantage Plan, presented by Mark Gottlieb, sponsored by Prince George's County Government and the Department of Family Services.
Hi, Mark Gottlieb here. I am an independent insurance agent, offer a wide range of products and focus on the mature market. Do a lot of work in the Medicare field. Uh, Actually, I'm certified by all of the companies that are offering these different products. So I know them well. So I've had many years of experience both in health services and insurance. As we mentioned, I'm independent, offer many products, Medicare, life insurance, long-term care, etc. I'm certified to offer all these products, so I often also know them very well. So I hope to impart a lot of good information to you. And I will mention that, after the presentation, I think at the end there will be my phone number and email address. And I always welcome people to reach out to me for more information, for literature, for product information, etc. There's no fees and no obligation. I try to be a source of information to people. And I know Medicare can be confusing to a lot of people. So hopefully by being here at this session, you'll feel a lot better about the options and the choices to you, as we're here in the annual enrollment period. So really, we always see all these announcements about the different parts of Medicare. I know you're seeing during annual enrollment a lot of flashing C's for Medicare Advantage. But I try to give you an overview of Medicare, not only about the products during AEP. So I'm going to take a little time here at the start to just do the overview piece. So really the government Medicare is Part A and Part B. I don't know who is in my audience who has one part, both parts, what have you, but that you obtain through the government. A is free if you've worked for at least 10 years and contributed to the Medicare Trust Fund. The main thing people know about A is that it covers your hospital stay, which is a great thing. It also will cover some short-term home care if you discharge, for instance, from the hospital and need some kind of intensive service for a short period. They also will provide short-term skilled nursing and rehab. Finally, Part A also covers something called hospice, which is, palliative and terminal care. So that's Part A. You should sign up for Part A when you're 65. Part B, you should sign up for either if you don't have creditable coverage from elsewhere. Creditable coverage usually means you're still working past 65, you have employer coverage, and so you sign up, but you don't have to sign up for Part B if you have employer coverage and you think the premium is reasonable, then it's a very good policy. You do not have to sign up for Part B. However, depending on that employer coverage, you do have the option of going into Part B plus some of the other supplementary products that I'll be talking about tonight. Part B then is therefore everything outside of the inpatient setting. So all the doctor visits, ambulatory centers, observation in the hospital setting, emergency room itself, on and on. We pay a premium for Part B. People are on Social Security. The money is usually, they can let the money be taken from their Social Security check. So you usually see an item saying, we've deducted this much to pay your Part B premiums. Right now, that number is $174.70 a month. Social Security will deduct it quarterly. That amount will go up a little bit as we hit 2025. There's a little annual increase. It's expected to be about $10 to $15 max. So we're waiting to see. I had hoped to have that information by now, but the government's taking a little longer before releasing that information. Okay, so you now have Part A, and if you have B, you're then looking at, you want to have prescription drug is D, and you can get prescription drug either as a standalone product, meaning through an insurance company, simply a Part D prescription drug plan, or you can have it with a Medicare Advantage plan if you signed up for a Medicare Advantage plan, which is Part C. So in effect, you'd have C and D. Now, I will say this right now, I'll say it again a little bit later. If you get Part D as part of your Medicare Advantage plan, doesn't mean all your drugs are included, which is a little bit confusing when you see these ads about, hey, you even have all your drugs covered with this plan. So kind of misleading, because what it means is the premiums you would pay if you bought a standalone policy are not going to be included. Whatever your premium is for the Advantage, it will include premium for prescription drug, but you're still going to have to pay for your drugs. So don't be fooled by that if you haven't yet, signed up for any plan or reached 65, what have you. So that's really A, B, C, and D. If you buy a C, that would mean you have A, B, C, and D, because you have to have parts A and B to sign up for Part C, which will then incorporate D. So you've got your A, B, C, D. Now, for those on the line who have a retiree or a TRICARE plan, you may not have to sign up for Part B. You need to understand what your coverage is. You need to learn about your outline of coverage from these plans and see if you must have B or not. In some cases, you might not need to have B. So when you're talking about retiree plans and TRICARE plans, they're outside the realm of all of these products I'm talking about for individuals. So there are a number of enrollment periods. This kind of gets complex, but that's why we're here tonight. So when you turn 65, if you're not yet 65, when you turn 65, you want to sign up at least for Part A. Again, if you have employer coverage that you like, you don't have to sign up for Part B because you don't want to have to pay the Part B premiums yet. So once we get past that, we're in the Medicare program, and now we come to October 15 to December 7, which is where we are right now. We're in the annual enrollment period. You can make changes or buy newly purchased Medicare Advantage and prescription drug coverage. So this is when people want to shop around. Again, we're being bombarded now when it comes to the Medicare Advantage products, but this is the time you want to be signed up by December 7th for coverage that will begin in January the 1st, 2025. There's actually something once we get to January that's called the open enrollment period. A lot of people are not aware of this. In this case, it's the first 3 months of the new year. And let's say you either started in a Medicare Advantage plan and all of a sudden you realize, well, maybe I didn't pick the right one, or I don't like the plan. It's different than I thought it would be. You have a right during open enrollment to change Medicare Advantage plans. You cannot sign up for a new plan. That has to be done during annual enrollment period. But if you already have a Medicare Advantage plan, you can switch Medicare Advantage plans during that period. A little known fact, but it's helpful to some people. Again, who may have signed up for something and feel like they've been misled or didn't really understand it, or they've heard after the fact that, hey, I didn't hear about this other Advantage plan that my cousin has, that my neighbor has, and that sounds really good. Can I get that before another year goes by? So that's open enrollment. Special enrollment, again, you lose your employer coverage. You don't have to wait to the next annual enrollment period to get covered. It triggers a special enrollment period. And there are other reasons too. It may have to be a change in geography. You're changing a residence, they give you 63 days. Why they pick the 63 as opposed to 60, I don't know, but you have 63 days to change to another plan without any penalties. General enrollment period, kind of a catch-all. If you fail to sign up for Part B in a timely manner, then eventually you try to sign up. They tell you, well, you're in a general enrollment period, and there's some different guidelines for that period of time. So that's kind of an overview of the enrollment periods. Again, we're now in that AEP. There are a number of penalties and enrollment guidelines. So this gets a little technical. I just try to quickly hit them. Again, there's a lot of information to digest. So if anyone has questions about these kind of details, I can take, a couple of questions along the way. I can take questions at the end. And the other thing is you'll have information about my email address and phone number. Anyone's free to call me, no fee involved, to try and get some clarification about these things, because it is kind of overwhelming to hear all of this in a short session. But in any case, you often hear Medicare Part B, you have 8 months from the loss of credible coverage to sign up for Part B without penalty. After that, there are penalties. I can't imagine anyone who doesn't have a Part B and doesn't know they should have a Part B. And certainly if you have employer coverage and you're going to be losing that coverage, I couldn't imagine you're going to wait 8 months before you turn around and sign up, for Part B. Usually you'll sign up for Part B before you lose your creditable coverage, so it will be there to cover you as soon as you lose your employer coverage. In terms of Medicare Part D, prescription drug, they do have a small penalty that comes out to about 1% per month if you fail to sign up. So let's say you're 65 years old, you get A and B. By the grace of God, you're very healthy. You take one high cholesterol pill, you get it at Costco for $2. You go, well, I don't need any prescription drug coverage. And all of a sudden, 4 or 5 years later, you say, starting to have some issues. I really need some drug coverage. Let me sign up for a Part D plan now. They will say that your premium is going to be about 1% per month times the number of months that you let lapse. So in my example, 5 years later is 60 months. So they would add 60% onto whatever your premium is for the Part D plan. All in all, as you'll see when I get to the Part D section, in effect, what I always tell people is some of these plans are extremely inexpensive, and you should not avoid signing up for a Part D plan. And the major reason is because we never know when something will happen to us, which would result in the need for a lot of expensive drugs. If we don't have a Part D plan, it's going to be a hurting situation. And you can't turn around and just sign up. I can't have a major medical problem and now say, okay, let me call in or call Mark, the broker, and say, what kind of Part D plan can I have? I'm going to tell you, sorry, you're going to have to now wait till the annual enrollment period next year. Then, of course, there are also different rules for employers and Medicare. So I'm not going to get into that tonight. I'm just going to assume we're talking individual coverage. And there's also something called COBRA. If anyone's either lost a job or left a job, they wanted to keep that insurance, there's something called COBRA, that you can keep your coverage, but if you had COBRA prior to 65, when you hit 65, you need to enroll in Medicare, and the COBRA is terminated. Different rules if you're past 65 and retired. Anyone, if there's anyone who has that situation, I have some some books, some regulations that I could email over to you to explain in much greater depth. It's hard to get into the details when I'm speaking for 45 minutes and covering a lot of information. So we'll leave it at that. Also, veterans should know that there are that typically covered through the VA, but they should have Medicare Parts A and B. And then the other thing is that there are veterans-only Medicare Advantage plans. So I'll get into that a little more in the Medicare Advantage section. So going on now to some of the other details. So here's an overview slide. Again, a lot of information. I'll try to hit a few highlights. Talked about the fact that there are no premiums for A. Part B has those premiums. There's something called an IRMA table, household income. It's actually called income related monthly average adjustment, IRMA. And there's a table that has the different rates for IRMA based on a person's income level. So if you have higher incomes, you're going to pay more for your Part B premiums. But they start at $174.70 a month. As I mentioned earlier, it will be probably increased just, very little, maybe $10, $15 tops starting January 1. Medicare Part A pays the first 20 days of care in an inpatient rehab unit or skilled nursing, assuming a person has a 3-day hospital inpatient requirement. So what that means is you have a stroke, you have an accident, you have any number of things. Unfortunately, the way our bodies are built, we can have many, many issues happen. We end up in the hospital and they say you really shouldn't just be discharged to home. You need a stay in an inpatient rehab unit or skilled nursing facility. And when they transfer you there, your first 20 days of care will be totally free, paid through by Medicare Part A. But that presumes you had 3 days in the hospital inpatient unit before you're transferred. So I just like to make people aware of that. If they tried to discharge you prior to 3 days and you ended up going inpatient rehab and you think you're covered, you're going to end up with a bill. So keep that in mind. There's a Part B deductible of $240. That means before Part B starts paying the 80%, which it does pay, there's a deductible of $240 right up front. So the first time, for instance, you go to a office building to see a specialist or to get some tests or whatever, which are covered by Part B, but they're going to say, okay, we need $240 before Part B begins paying for that. The other thing, of course, the next paragraph is Part B covers 80%, not 100, as with Part A. So that's the big dilemma for a lot of people. Okay, it pays 80%. I'm responsible for 20. Now that's okay if you go into a physician's office that charges $100. Part B pays 80. You're going to pay 20% of the 100 is $20. No problem. But as I said up above somewhere, or on the first slide, Part B covers everything from specialty visits to ER, to observation units in a hospital, on and on, to expensive exams. So those 20% really add up. That's why people think about buying Medicare supplement or Medicare Advantage plans. Okay, and then the bottom paragraph talked about that as well. That's fine. We can go on. I don't want to take more time than we have, but there are a number of programs for those who are lower income people should know about, and they're very important. So in particular, there's something called the Medicare Savings Program. I don't know if any people in this broadcast are in the Medicare Savings Program. People should know about the Medicare Savings Program. So if you don't qualify for Medicaid, which will cover all your costs, but you do need some help, you're kind of on the lower income spectrum. We're usually looking in the vicinity of 17 to 23,000 would generally qualify you for one of the levels of the Medicare Savings Program. If anyone needs any information about that, again, you'll have my email. You can email me and I'll be happy to send you some information. So it's a very important program to be aware of, offered by the government. If you qualify for this Medicare Savings Program, you automatically qualify for what's called the Extra Help or Low Income Subsidy Program. I don't know if anyone here tonight is on the Low Income Subsidy Program. If you're in these kind of income categories and you're not, you need to be aware of this. It can save you a lot of money for your drugs. So the Medicare Savings Program is for medical. The Extra Help LIS is for the drug. Okay, and there's a little more information here and getting into real detail, which I'll skip for the moment. There's also something called the State Pharmaceutical Assistance Program. We don't have to go back, I'll just explain it. It's a State Pharmaceutical Assistance Program. If your income is anywhere up to like 44,000, much higher than the low income subsidy stuff, you can get the program through the state to pay for your premiums for your prescription drug plan up to $60 a month. It's a nice savings of $700 to get this program to pay for your premiums if your premiums are that high. Of course, if you have a plan where your premium's $5, yeah, they'll pay it. So you'll save, 5 times 12 months, $60. But for those with higher premiums, it's a nice savings. So, okay, we've talked about A and B. We're going on now to Part D, which is what we're talking about during the annual enrollment period, also known as PDP, prescription drug plans. They're offered by private insurance companies. A number of the companies are well known by people. Just some of them, for instance, are AARP, United Healthcare, SilverScript, which is a very popular prescription drug plan. Cigna has a very good plan, another plan called WellCare, and there are others as well. So these insurance companies subcontract for the prescription drugs you take with the multiple pharmacy chains. Just a few of them listed: CVS, Rite Aid, Walgreens, Costco, and there's about 28 pharmacy chains that offer drugs. Pretty remarkable. So some of the issues, you want to make sure, if you can, that you're using a preferred pharmacy versus non-preferred. The costs could differ. There's also the issue of generic versus brand name drugs. Hopefully everyone's aware of that. Sometimes the brand is the brand and it's very costly and there's nothing you can do about it, other than perhaps looking for some manufacturer discount programs or using a discount card, which is different than a Part D plan. But after a certain amount of time, the brands go off their patent and they become offered in the generic way of drugs. And so when you get to the generic level, it can save you a lot of money. So we need to be aware of that. In 2024, we had 3 phases. We had what's called the deductible. You pay retail until you hit that deductible, which is this year it's $545. Then you go into a category called, the basic level. And the drugs are priced by tiers. And as you can see down here, there are 6 tiers. A couple of generics, a couple of brands, a specialty tier. If you're taking specialty tier drugs, it's usually much more expensive, not surprising. Tier 6 is for diabetics who take insulin. Every single prescription drug plan now offers tier 6 insulin at $35 a month. They've improved that over time. Several years back, that wasn't the case. Then they all began offering it. Of course, we always hear about that when we're during the election period. We're talking about what good things have the Democrats done, and one of them is through the Inflation Reduction Act, they made sure that all drug plans now offer insulin at 35. There's something called a formulary. You have to be aware of which of your drugs are in, quote, the formulary, which is an approved list of drugs, and it can differ from drug plan to drug plan. This gets very technical, but it's important for you to be aware of how this works. And this probably gets a little too detailed. So again, there were 3 phases, but the good news, the big deal on this slide is simply that in 2025, they narrowed the prescription drug plans down to $2,000 of out-of-pocket maximum. There were people taking a lot of drugs who could end up paying a lot more for their drugs. With the new regulations starting January 1, all you'll have to pay is a max of $2,000, and then you'll be 100% covered. So that's, very important, and it's some great news. We're hoping that the momentum continues because they're on the docket to negotiate for the 10 highest cost drugs to be repriced so that in 2026, some of those drugs in those tiers will again be a lot less expensive. So the final thing I'll say is going to be the next page to kind of summarize Part D coverage. So here you go. The best choices are going to be the plans where you're figuring out your total cost. The total cost is going to be premium plus copays. So here's my advice. You don't necessarily just sign up for the plan that has the lowest premium. No, because there are some very low premiums, but the copays, the specific drugs in those tiers may be more. So you have to look at both the premium and the copays. So I'll drop down and get right to it. There's something called the Medicare Plan Finder, which is how you figure that out. There's a whole approach where you go to Medicare.gov and Part D, or you can Google in Medicare Plan Finder, and it will bring up this tool that allows you to enter all your drugs into it. When you're finished entering them in, you hit done adding drugs, and it spits out a whole list of all the drug plans in your area. It's really done by county. So, when you're always hearing, and you'll hear this for Medicare Advantage too, they're always saying, what zip code do you live in? They're simply trying to determine what county you're in. And drug plans differ and Advantage plans differ by county. But in any case, it will give you the printout showing premium plus copays, least cost plan, given your set of drugs is going to be WellCare or Cigna or whatever have you. So that's how one determines how to calculate their drugs. I also have a very good article about that. Again, if you'd like to email me, please send me a copy of that article. I'll be happy to send that to you. So one last thing, use of discount cards. A lot of people see these GoodRx, WellRx, whatever discount cards on the pharmacy window. They are discount cards. In some cases, you may even get a better deal on certain drugs by using that card, but it will not count towards your $2,000 out of pocket through your Part D plan. So you have to use it judiciously because you're not going to get the credit for getting to the maximum of $2,000. But they can be helpful in some cases. But again, remember the discount cards are not a Part D prescription drug plan. And you should all have a Part D prescription drug plan, because if God forbid something serious, hits you and you start needing to take very expensive drugs, there may be some discounts on them, but you're certainly not going to get as good a deal as if you are in a formal Part D plan. So that's, I think, the end of the Part D section. So there you go. There's a lot of options about your A's and B's, your D, take A and B, and a Medicare Advantage plan that has prescription drug in it. There are veterans plans that are called Medicare Advantage only, but you should have the drugs. It's actually not the PDP, it's just the drugs from the VA. So veterans get their drugs through the VA, so they don't necessarily need a MAPD, which is most of us what we need, because it's going to have Medicare Advantage and prescription drug. We don't have access to drugs through the VA like the veterans do. Again, if you have a retiree health plan, you want to understand what's in it. Just don't say, I'm covered. I've got federal employee, this or that. Probably is good, but you don't know exactly. Well, you don't need it. Go ahead and get the information you need. It's things called outlines of coverage, evidence of coverage. Now, this could be retiree health plan. It could be governmental. It could be from a large company. If it's from governmental, you're going to be looking at information from opm.gov. Some of the federal plans are through the mail handlers, Federal Employee Health Benefits Program, government employees. I forget what HA stands for, but GIHA is well known. So, whatever your plan is, you want to know what it is. How much are you paying for it? What's the outline of coverage? Meaning, do you have deductibles to pay? Do you have co-pays for certain services? Is there an outpatient maximum? So, it could be a very good plan. It could be a well-priced plan, but you have an option of buying coverage outside of that plan if it's highly priced and it leaves you paying certain co-pays or out-of-pocket maxes. But we should all understand what we have, and unfortunately, a lot of the population does not until they use it, and then they're surprised with, some bills that they had no idea they were responsible for paying. So I urge all of my class people to talk with your benefits administrator, go to your website, get your information, know what you have, know it before you need it. So with that, I'm going to move on now to Medicare supplements. I think there may be one other page. So there's some gaps in coverage. I don't want to take too long on this. We have about 20 minutes or so. So, there are the Part A and B deductibles. There's that 20%, which Part B does not pay. So if you have a lot of Part B expenses, that's a lot of 20%. There are co-pays for days 21 through 100 in the rehab or skilled nursing. I talked about going in the first 20 days of free if you had 3 days hospitalization. But then days 21 through 100, there's a $204 charge per day. And that will go up a little bit again starting January 1. I don't have the figures yet, but in any case, that's expensive enough. So if you have some serious issues, let's say you're in rehab 40 or 50 days. That's about 30 days worth of paying $200 a day. Well, that's why people buy Medicare supplements and Advantage plans. Then if you watch all the ads and you get all the flyers, the other reason they talk about you wanting to buy Advantage plans rather than just having A and B and maybe even A, B, and D is because there are other services that they can fold into an Advantage plan, such as dental and dentures, vision and hearing, some cases acupuncture, etc. So, we'll talk about that in the next few slides, but be aware. So there's that first 20 days, there's the 21 through 100. Now going to move into the 101st day. Typically, that means you've hit the territory called long-term care. If any of you have ever heard about long-term care insurance, or at least doing your long-term care planning, so you're educated as to what long-term care is and what kind of costs one can be facing if you get into that territory. So because of all these gaps, so to speak, we have two choices for filling those gaps. So one way of filling the gap is Medicare supplement plans, otherwise known as Medigap. They're one and the same. Sometimes people will have a Medicare supplement plan and they'll ask me, well, do I also need a Medigap plan? Exact same plan. This supplements what A and B gives you. This gap fills the gap of what you don't get from A and B, but it's the same thing. They're sold by private insurance companies. They will cover that 20% not covered by Part B. That's a great thing. You go to an outpatient center, you go for imaging for an MRI, you go to the emergency room. Here's my A and B. Here's my Medicare supplement. Here's my 80%. Here's my other 20. I'm free. I paid my premium for my Medicare supplement. That's all I should have to pay for the most part, okay? Typically, you'll buy a Medicare supplement plan within the first 6 months of signing up for Part B. And the one reason you want to do it within 6 months, ideally you should do it as soon as your Part B is starting, so you don't have that 20% responsibility. But if you wait, remember that there's a guarantee issue. That means no underwriting. You purchase it within the first 6 months. Okay, so I sign up for Part B, starts January 1. I have till June 30 to buy a guaranteed issue Medicare supplement. The reason that can be important is because perhaps I have a lot of health problems. Medicare supplements are sold by private insurance companies. They're not going to approve you if you have significant health issues. But the first 6 months, you have guaranteed issue. No questions asked. Doesn't matter what health issues you have, they will approve you. You're automatically approved. Then you have supplement coverage. So it's a wonderful thing. There are a couple of other situations where you can get guarantee issue. One is if you're losing coverage involuntarily, means you're not just saying I want to get out of Medicare Advantage, as an example. So this actually, if you're losing an MA plan, so this relates to if you have a Medicare Advantage plan, you're moving to a different location. Let's say some of us maybe have elder parents who are coming to live near us. They're coming from anywhere in the United States. What's their coverage? They have a Medicare Advantage plan. I'll get a call. Okay, my mother's moving from Kansas City. She has a Medicare Advantage plan. She needs an Advantage plan which is offered in this area, because Advantage plans are offered again by county. And you find out that you can buy a Medicare supplement if you prefer for the first 2 months after your mom moves. If she was in a Medicare Advantage plan, we could either get her a new Advantage plan, or she can get a guarantee issue Medicare supplement. Some people like to have a supplement because it's freedom of choice, no restrictions. You can see any provider you'd like anywhere in the country. So, and that's a nice thing. And again, just instead of copays, you just have that 20%, which isn't covered by Part B, and you're done. One other thing I like to point out to people is they might have signed up for Medicare supplement plan a number of years ago. With supplement plans, the premiums go up by year. And then sometimes the companies just institute price increases. So you might have started paying $150 a month. Now you're at $250 a month. Now that's getting a little more than I really expected. Isn't there anything a little lower? Uh, if your health allows, you can shop around any time of the year for Medicare supplement. The AEP rules do not apply to supplements, only to Advantage plans and prescription drugs. So you want to shop around? Yeah, fine. Let me, how's your health? Okay, good. What's your age? And I'll look around for 8 other companies and we'll see if there's something significantly less than the 250. Sometimes it's, depending on your age, you're even up to 3 or 350 a month. Boy, I'd really like to see if there's something that's $50 less a month, a savings of $600, nothing to sneeze at. You can shop around, but the other issue is now you call and you say, I want to get a Medicare supplement plan. What's your health issue? Well, a lot of things have happened to me. The private insurance company is going to say, no, thanks, we don't want you. You're too high a risk for us. We're not taking you. But the good news is there's something called the new birthday rule. So you can automatically, that's a guarantee, issue approval of a Medicare supplement plan. If you have a plan already and you're trying to change, looking for a better priced plan, you can, and on your birthday month, you can shop around, no underwriting again. So this has been a tremendous rule for a number of people. It's helped them save money by switching insurance companies. So the plans are plans A through N. A person who's on SSDI, who now is on Medicare, but they're under 65, they can really only get a plan A, which has some limitations. Rest of the plans are much more full. Most of the most comprehensive plans now are called Plan G. These plans are A through N. That's not to be confused with Medicare Parts A and B. So it confuses a lot of people. So most people are going G, but maybe let's say I quote you G, it's $150 a month. It's a little out of my range. There is an N plan, about $40 a month less, and it's full coverage except you have a $20 copay for each outpatient visit you do. You don't have a whole ton of needing a lot of care. It's a lot of $20 copays, which could really increase your prices. Okay, so we're into features of Medicare Advantage plans. Could we go back one if you're able to? Well, we'll start from here. Okay, I'll just explain. This is fine. The previous slide basically says Medicare Advantage plans are private plans. They're offered by insurance companies, the healthcare provider organizations. A provider organization, for instance, would be a Kaiser Health Plan. They provide care. They also have a license to serve as a Medicare Advantage plan. What you're doing when you sign up for an Advantage plan is you turning your A and B coverage over to that Advantage plan. So for instance, when you go to a doctor, to an ER, wherever it is you go, they don't want to see your Medicare A and B card anymore. They want to see the card that you now have from your Advantage plan. So that's, one thing people have to know about when you sign up for an Advantage plan. You're then going to be using, we're going to be living by their regulations, and you're going to be using the providers that are in their networks. I'll explain that a little bit more in a minute. So at the top, prices are consistent regardless of age, which is a great advantage. No, please don't go down yet. It's a great advantage because let's say you're buying a Medicare supplement plan and you're now 75 or 80. Well, that's the price is going to be up there because it's increased over the years. Where the Medicare Advantage plan, no matter what age, it's the same price. So whether you're 65 or 90, that same premium applies, which is a wonderful thing. There are a number of plans for those who are on Medicare and Medicaid, or not on Medicaid, but in one of those other income levels that I talked about in the Medicare Savings Plan. You can get plans called dual eligibles, which are very good plans, offer a lot of benefits. So that's one thing you should know. Medicare Advantage plans is no underwriting. I mentioned with supplements, they will look at your medical condition. With Advantage plans, there is no medical underwriting. They will accept anyone with any condition, which is a real blessing. Now, there are two types of Medicare Advantage plans. One's called an HMO plan. The other is called a PPO plan. HMOs mean you must use only people or only facilities in network. Okay, it's like an HMO plan for the under 65. So you have to make sure you know who's in network, what facilities are in network. If you use something out of the network, they will not pay a penny. I have people occasionally who didn't understand that. They went to another physician group outside of their, Medicare Advantage network, and then they got a bill and they didn't understand that they have to be in network if it's an HMO plan. When you get to a PPO plan, you get two choices. You have in-network, which is the less expensive option, or you can go out of network, but it's going to be an increased out-of-pocket cost, significantly increased out-of-pocket cost. So we certainly try to stay in network whenever possible. And of course, with Advantage plans, you get those added values. One of the things you have to be aware of, like I mentioned with prescription drug, just because you join an Advantage plan doesn't mean you're getting all your drugs for free. There won't be a separate drug premium, but there are going to be for drugs, the premiums folded includes the medical and the drug, but then you have a series of copays. When you talk about dental, they a lot of them say, well, you'll even get dental, which is somewhat of an exaggeration. You will get preventative dental. Okay, preventative dental will typically be a fluoride treatment, a set of x-rays, an exam. If you have dental issues that you want to be taken care of, you'll typically have to, what I'll call, buy up. You'll have to pay an additional premium. So they may say the premium for the base plan is $30, and if you want $1,000 of coverage to pay for a root canal or whatever else, it's another $30 of premium. So it may be good for you, or may not. They keep changing the dental offerings. Some of the newer plans give you more than $1,000 of dental. You have to be aware that signing up doesn't mean all of a sudden you can take care of all of your dental issues. It's more preventative in nature. There'll be vision, maybe a free eye exam and a pair of glasses for up to $200 worth if you go to one of the following vision chains. Hearing, you'll get a hearing exam. People who might need hearing aids, for instance, are going to want to shop around, as it is with dentures, because the different Advantage plans have different contracts with manufacturers of dentures, of hearing aids. So you want one of those two things, we got to shop around and see which is going to be the best deal from which Advantage plan. The most important thing, if you have especially a physician or a specialist that you've been going to, that you like, that you want to stay with, your first question before signing up for any Advantage plan is to go to that physician's office and ask, does this practice participate with this particular Advantage plan? There are about 6 different Advantage plans. That may help you decide which Advantage plan you would like to sign up with. If you're in the dual eligible range, there's a lot of add-ons. free transportation, meals after hospitalization, money for over-the-counter supplies, utilities, and healthy foods. Extra dental may include dentures, etc. So, those are really very attractive plans. And I'll leave it at that. The last point basically says you have to be careful about trying to say, okay, I want to get out of an Advantage plan. I want to go back to what's called original Medicare, Part A and B. I'd rather have a supplement. Well, again, a supplement, you got to get underwritten. If you cannot get approved for a supplement and you withdraw out of that Advantage plan, you can have A and B, but you're going to be left with that 20% again. So we'll move on. There's just a few more slides here as we approach 8 o'clock. Thanks for staying with me. Some major features to consider: premiums, networks. Remember, hospitals are in networks too. So if you have a particular hospital you like to use, you have to know which Advantage plans have which hospitals in them, or different providers, or ambulatory surgery centers, or a range of things like that. We've discussed the HMO versus PPO. The major distinguishing factor of an MA plan versus a supplement is with the supplement, you pay the higher premium than you're covered. With an MA plan, you have small premiums. There are even some plans now being offered for zero premium. Then you're going to have that copay schedule up to an out-of-pocket maximum. So, you join an MA plan, you go to the specialist, $45 or $50 a visit. ER could be $100 to $150. MRI exam $2.25 to $3. Even, some copay for the first 5 or 6 days of hospital care. So don't be surprised by all of this. This is how an Advantage plan is structured. So those are the major differences until you hit that out-of-pocket max. And then, of course, you get those value-added features, but are they worth it? So, it's a tricky equation. And it often comes down to, well, I can save some money if I pick an Advantage plan if I don't have major medical issues. I'm going to end up paying more if I have an MA plan and I'm using days of hospital care followed by days in rehab, getting MRI exams, getting 20 physical therapy visits after this, all of them at copays till you hit an out-of-pocket max, which would be significantly more than what you paid for a supplement. So, and we don't know. That's the problem in anything, when you're buying insurance, we just can't predict what's to come. So please advance the next slide. I'm just about finishing up here. It's 8 o'clock. Medicare Advantage only plans for veterans. One of the big, features of these plans, you can go to VA, but you can also have an MA only plan. Then you get a whole network of physicians and other providers locally, which can be very nice. One very big attraction is something called the Part B buyback. You'll see some of the commercials for these companies, and they'll talk about the buyback, but these commercials are not necessarily localized to the DC metro area. The only buyback plans are those for veterans. Buyback means they'll pay you back some money towards your Part B premium. So if I'm a veteran and I'm paying that $174.70 a month, I enroll in an MA plan with a $60 buyback. I'm gonna save $60 to offer that $174. So it's a nice deal, plus a number of different, programmatic features. So it could be a very good thing. Advantage plans, just quickly. Okay, this gives you an idea. There's a lot of plans out here now. It's a good thing to have choice. It's a bad thing because it's extremely confusing. So really, we have AARP. United Healthcare has a few PPOs. Aetna has an HMO, and I just discovered I'm still getting some new plan information. also has a PPO. Company called Alterwood has a couple of HMOs. Care First has now converted to PPOs. I apologize. I put this presentation together just before I got my final inventory of plans. But needless to say, the point is a lot of choices, a lot of decision making. Humana, pretty popular company. They're doing a lot of advertising. They too have 2 PPOs. Hopkins does not have a plan in Montgomery at this, in Prince George's at this point. And I'm sure people are familiar with Kaiser, which has 3 different HMO plans. So, you know, which ones do you pick? All of the features could be a little different. Again, it could often come down to which doctors and hospitals you're most comfortable with that you already use. And then it's a matter of finding out which of these plans do they participate in. Hopefully, as in-network providers, you get that less expensive rate on the different copays. It's my value proposition. I can help any of you, you know, on the line or anyone you might know who needs some help. I charge no fees. There's no obligation. I can basically help you break down all of this information and come up with the best options for your particular situation. And the premiums are the same from all the different companies as well. There's no, you know, buy-up, so to speak. So, you know, I make that as my value proposition. You're free to get a hold of me to get information about anything I've spoken about. You're free to call me for some advice or to see if you'd like me to assist you in, you know, figuring this out further and figuring out which plan is best for you. So thanks for that. And I think that should do it. So we'll say thank you for tuning in this evening. And again, there was a slide with my email and phone number information if anyone would like to contact me. I can quickly say it if anyone would like to just write it down. My phone number is 301-332-4337. Email address is Mark, M-A-R-K, Gottlieb, G-O-T-T-L-I-E-B as in boy, @gmail.com. And thank you very much for your attention. I hope it was helpful.